My name is Lim. My paper title is Factors Influencing COVID-19 Vaccination Intention in College Nursing Students. I start speaking my research content. 1. Introduction. 2. Research method. 3. Results. 4. Discussion and conclusion. 5. References. I'm speaking 1. Introduction. Research need for research. Coronavirus is an RNA virus that can infect alpha and beta with humans and animals, and gamma and delta with animals. In particular, SARS-CoV-2 is the cause of COVID-19, which began in China in November 2019. Clinical symptoms range from asymptomatic to severe, mainly through droplet transmission through the respiratory tract of an infected person. Korea first had a COVID-19 confirmed case at January 2020, but due to the development of transportation, the WHO declared COVID-19 an international public health emergency in January 2020, raised the risk to very high in February, and declared it a pandemic in March. In October 2020, it was estimated that about 10% of the world's population was infected in consideration of asymptomatic infections. It is one of the worst infectious diseases in mankind, and the fatality rate varies from 0.1 to 25% due to the global fatality rate, infection status, population age, and various factors, which deaths of nurses and teenagers in their 20 and 30. As the situation gets worse, only vaccine emerged as a solution, and vaccinations began in December 2020 for the first time in the UK with rapid vaccine development, and vaccinations from each country are also continuing. The COVID-19 vaccine in Korea began on February 26, 2021, and 93.7% of COVID-19 confirmed patients aged 80 till 49 were unvaccinated. 4.2% were primary, and 2.1% were inoculated from April to August, when the inoculation was completed. Among those who were not vaccinated, 96.3% were 18 till 29 years old, 91.4% 30 till 39 years old, and 19.4% 40 till 49 years old. In addition, in order to evaluate the effectiveness of preventing serious illness and death from vaccination, the severity rate of unvaccinated patients among 18 till 49 years old was 0.85% from May to July 2021, while the severity rate was 0.17% among those who completed vaccination. In order to receive the first dose of 17% COVID-19 vaccine, the primary goal for the formation of COVID-19 herd immunity, the participation of 18 till 49 years old was emphasized. Meanwhile, vaccination for 18 till 48 years old starts on August 26, 2021, and the reservation rate on August 22, 2021 was 64%, less than the government's minimum expectation of 70%. The subjects analyzed that vaccine fear, such as breakthrough infection, confirmed even after completion of vaccination, anxiety due to side effects of the vaccine rather than COVID-19 infection, and distrust due to inoculation accidents affects the reservation rate. However, in the absence of a cure for COVID-19, prevention is the best option. Since the mutant virus is spreading rapidly in a situation where the immune capacity of most vaccines is decreasing, the time has come when an additional immune response must be strengthened. The U.S. Centers for Disease Control and Prevention has already decided to implement a booster shot from September 2021. Just like domestic experts are also vaccinated against influenza. The necessity of annual vaccine was emphasized. Accordingly, the Korean government announced plans to inoculate additional vaccines to strengthen the preventive effects for those who have been vaccinated 6 months after completion of the COVID-19 vaccination, while the vaccination is in progress. Priority vaccinations are given to workers, residents, and patients in nursing hospitals and nursing facilities, as well as medical personnel and healthcare workers for compound COVID-19 patients. The hospital environment can impact your patient and step through the respiratory tract or the blood or secretions, such as the droplet by a variety of pathogens present. Nursing college students are highly likely to be mutually impacted by contacting patients during clinical practice as medical professionals. Therefore, nursing students need to change their health beliefs so that they know the importance of vaccination and prevention infection as medical professionals. It is necessary to identify factors that increase nursing college students' intention to vaccinate against COVID-19 and to form a motivation to practice health beliefs and attitudes. To this end, we intend to apply the health belief model, a model that best explains individual disease prevention and behavior motivation, such as vaccination. Until now, it is difficult to find a study on the degree and intention of COVID-19 vaccination for nursing college students. Therefore, this study aims to provide basic data to investigate the COVID-19 vaccination status of nursing college students who have not experienced clinical practice and to identify factors affecting vaccination intention and to prepare strategies to increase the COVID-19 vaccination rate in the future. Research purpose. This study is a descriptive research study to find out the factors in which perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, and self-efficacy affect vaccination intention of nursing college students who have not experienced clinical practice. First, the difference in the intention to vaccinate COVID-19 according to the general characteristics of the subject is identified. Second, it identifies the subject's perceived sensitivity to COVID-19 vaccination, perceived severity, perceived benefit, perceived disability, behavior opportunity, self-efficacy, and degree of vaccination intention. Third, it identifies the correlation between the subject's perceived sensitivity to COVID-19 vaccination, perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention, and identifies factors affecting COVID-19 vaccination intention. Research design. This study was conducted to identify perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention of nursing college students who have not experienced clinical practice. Research tools. General characteristics. The general characteristics consist of a total of 7 items: gender, age, vaccination process, vaccine type, vaccination side effects, previous post-vaccination side effects, and health status. Perceived sensitivity. In the tool developed by Go Kyung-min, the flu was changed to COVID-19 as and used. It is a 5-point Likert scale with a total of 4 questions, ranging from strongly agree to not either with 1 point, with a higher score indicating a higher perceived sensitivity to COVID-19 vaccination. In the study of Go Kyung-min, Cromba alpha 0.837 and the reliability in this study was Cromba alpha 0.878. Perceived seriousness. In the tool developed by Go Kyung-min, the flu was changed to COVID-19 and used. It is a 5-point Likert scale with a total of 4 questions, ranging from strongly agree to not either with 1 point, with a higher score indicating a higher perceived seriousness to COVID-19 vaccination. In Go Kyung-min, Cromba alpha 0.827 and the reliability in this study was Cromba alpha 0.726. Perceived benefit. In the tool developed by Go Kyung-min, the flu was changed to COVID-19 and used. It is a 5-point Likert scale with a total 4 questions, ranging from strongly agreed to not either with 1 point, with a higher score indicating a higher perceived benefit relating to COVID-19 vaccination. In this study of Go Kyung-min, Cromba alpha 0.746 and the reliability in this study was Cromba alpha 0.870. Perceived barrier. One of the tools developed by Go Kyung-min was modified and used with a sentence: I think that vaccination puts a burden on the government and health insurance finance. It is 5-point Likert scale with a total of 4 questions, ranging from strongly agreed to not either with 1 point, with a higher score indicating a higher perceived barrier related to COVID-19 vaccination. In Go Kyung-min, Cromba alpha 0.715 and the reliability in this study was Cromba alpha 0.574. Cues to action. The tool developed by Woo Hyung-suk was used. It is a 5-point Likert scale with a total of 3 questions, ranging from strongly agree with 5 points to not either with 1 point, with a higher score indicating a higher cues to action related to COVID-19 vaccination. In the study of Woo Hyung-suk, Cromba alpha 0.77 and the reliability in this study was Cromba alpha 0.612. Self-efficacy. Based on the tool developed by Gojiana, modified and improved by Kim Young-hee. Yeom, Hyun-suk, and Park Eun-ju flu was modified to COVID-19 for this study and use. Among them, one question was modified and used to say, I can receive regular vaccinations if necessary for the prevention of infectious disease. It is a 5-point Likert scale with a total of 5 questions, and the score ranges from 5 points of strongly agreed to 1 point of not at all. The higher the score, the higher the efficacy related to COVID-19 vaccination. In the study of Gaussian Columbus alpha 0.802, in the study of Kim Young-hee, Hyun-ju, Hyun-suk, and Park Eun-ju Columbus alpha 0.941, and the reliability in this study was Columbus alpha 0.941. Vaccination intention. Based on the tool developed by Gaussian, modified and improved by Kim Young-hee, Hyun-ju, Hyun-suk, and Park Eun-ju flu was modified COVID-19 for this study and used. It is a 5-point Likert scale with a total of 4 questions, ranging from 5 points for strongly agreed to 1 point for not at all. A higher score indicates higher intention to vaccination against COVID-19. In the study of Gaussian Columbus alpha 0.875, in the study of Kim Young-hee, Hyun-ju, Hyun-suk, and Park Eun-ju Columbus alpha 0.918, and the reliability in this study was Columbus alpha 0.890. Research method. Ethical consideration of research objects. In this study, the researcher explained the purpose and the contents of this study online, guaranteed anonymity, and explained the ethical aspects of the study, that the survey could be stopped if unwanted, and then agreed. It was made to fill out using the Google Online questionnaire, and the time required for the question was about 10 minutes. Data analysis method. The analysis of the collected data used the IBM SPSS 25.0 program. The general characteristics of the subjects were analyzed by frequency, percentage, mean, and standard deviation. Perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention related to COVID-19 vaccination use, mean, and standard deviation. The analysis of perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention relate to the general characteristics of the subjects was analyzed by t-test, ANOVA, and Shepherd test. Pearce correlation was used to correlate the subjects' perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention. Factors influencing COVID-19 vaccination intention were analyzed using multiple regression. Results. General characteristics of subjects. Looking at the general characteristics of the subjects, there were 27 male students and 110 female students, and the average age was 23.47 years. There were 63 subjects who were not vaccinated against COVID-19. 62 subjects received the first dose and 12 subjects received the second dose. Among the subjects vaccination against COVID-19, 56 were vaccinated with Pfizer biotech vaccine the most, and 23 responded that there was a vaccine side effects after being vaccinated against COVID-19. After the previous vaccination, 125 answered that there were no side effects, and 104 answered that they were in good health. Differences in COVID-19 vaccination intention by subjects. There was no statistically significant difference in the intention to vaccinate against COVID-19 according to the general characteristics of the subjects. Degree of perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention of COVID-19. The subjects perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention were analyzed. Perceived sensitivity averaged 16.41 out of 20. Perceived seriousness averaged 15.69 out of 20. Perceived benefit averaged 14.61 out of 20, and perceived barrier 11.31 out of 20. The subject's cues to action was 11.66 points out of 50 points, and an average of 28.939 points out of 20.39 points per self-efficacy. The subject's intention to vaccinate out of 25 points averaged 15.74 out of 20 points. Correlation among perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention of COVID-19. The correlations among the subjects' perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention relate to COVID-19 vaccination were analyzed. COVID-19 vaccination intention showed a significantly positive correlation with perceived sensitivity, perceived seriousness, perceived benefit, cues to action, self-efficacy, and significantly negative correlation with perceived barrier. Influencing factor of COVID-19 vaccination intention. Factors affecting the intentions of nursing students to be vaccinated against COVID-19 were identified. A stepwise multiple regression analysis was performed, including the perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, and self-efficacy related to COVID-19 vaccination that showed a significant correlation with vaccination intention. Influencing factor of COVID vaccination intention, and the test result to satisfy the assumption of residuals satisfy their linearity, normality, mutual independence, and equal variance. The regression model for the subject's intention to be vaccination against COVID-19 was found to be significant, and the adjusted coefficient of determination was 0.80. The factors affecting nursing students' intention to vaccination against COVID-19 were as follows. Total amount of change in the order of self-efficacy, perceived benefit, and cues to action, 80% was explained. For discussion and conclusion, this study investigated the effects of perceived sensitivity, perceived seriousness, perceived benefit, perceived barrier, cues to action, self-efficacy, and vaccination intention to COVID-19 vaccination of second-year nursing students who did not experience clinical practice. This is a descriptive research study to understand the relationship and to examine the factors that influence vaccination intention. As a result of this study, the higher the self-efficacy, the higher the perceived benefit, and the higher the cues to action, the higher the vaccination intention of nursing students for COVID-19 vaccination. COVID-19 vaccination intention showed a significantly positive correlation with perceived sensitivity, perceived seriousness, perceived benefit, cues to action, self-efficacy, and a significantly negative correlation with perceived barrier. The factors affecting nursing students' intention to vaccination against COVID-19 were as follows. Total amount of change in the order of self-efficacy, perceived benefit, and cues to action, 80% was explained. Comparing with other vaccination-related studies that applied the health belief model, Yeom found that in the study on vaccination intentions recommended for nursing students, it was found to have an effect in the order of cues to action, self-efficacy, and perceived benefit, which was the same as in this study. In the study of flu vaccination intention, Kim Young-hee, Haeun-ju, Im Hyun-suk, and Park Eun-ju found that perceived seriously, perceived benefit, cues to action, and efficacy influenced flu vaccination intention. As a result of comparing the COVID-19 prevention intention study applying the health belief model, Kim Soo-yeon, No Hyun-yeon, Yeom found that perceived serious risk, perceived vulnerability, and perceived benefit were related to preventive behavior intention and were not related to perceived barrier. 홍다의 정미나 조창환 also showed the same result as in this study, as it was related to perceived seriousness, perceived vulnerability, and perceived benefit, but perceived barrier did not affect. It is understood that the vaccination intention was felt more than the perceived barrier, as various support was provided for prevention as the infection situation worsened and many of the disability-related parts such as side effects, time burden, and financial burden were resolved. As a result of this study, in order to increase the intention of nursing college students to be vaccinated against COVID-19, a strategy to emphasize self-efficacy and the benefits of vaccine through various educational programs and improve the opportunity to act is considered necessary. As a limitation, since it was limited to the second graders of a nursing college, it is necessary to be cautious in generalizing the result of this study to all nursing students. Based on the result of this, I would like to make following suggestions. Thank you.